Hello, hello. Today we are going to talk about the ABCs of OOO. If you came to talk about women's sexual health, orgasms, then you've come to the right place. Welcome to When Docs Talk, the ABCs of OOO.
When docs talk, when docs talk, when docs talk, when docs talk. When docs talk, 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 when docs talk.
All right, we are back. If you're just joining us now, you are in the right place if you came to talk about orgasms, women's sexual health, and everything that goes in that category. We're here with the rest of the WDT crew. When Docs Talk, how y'all doing, ladies?
Great.
Wonderful. Great.
You know, it's been a minute since we've had the whole crew together. For those who've been watching for a while, you know you've seen some faces kind of on and off. I want to tell you a little bit about When Docs Talk before we jump into the subject matter. When Docs Talk is a collaborative of healthcare professionals. We are emergency practitioners mainly, but we are also family practitioners. We are nurses. We are advanced practice providers. It's a host of us who joined, but we're joined by so many different guests. We have guests in every profession, depending on what we're talking about. And we are so excited about our experts today. You're going to love them. But I want to start off by thanking you all who have been following us. Thank you for helping us get almost 2,000 subscribers on YouTube and almost 7,000 subscribers on Facebook. We love you. We're excited that you're joining us. Keep the questions coming. I know it's been a little bit since you've seen us, and some people have sent messages about the topic matters that they'd like to hear. So we want to know what you want to know. Let us know. All right, I'm going to stop talking. Tell the people who you are, ladies.
Okay, so I am Dr. Sonia Pinson. I'm a FP doc working in an ER setting, also a Navy vet. Glad to be here, and can't wait to get into this discussion.
Hey there, my name is Morgan. I am a registered nurse, and I have been with When Docs Talk since day one. I'm glad to be back. I am so excited about this topic tonight. I'm here for it, and it's going to be a wonderful show.
Yes.
Hello, everybody. My name is Davita Pete. I am an ER trauma traveling nurse. I've been here for forever. I'm excited about the content for tonight. I'm ready to get into it.
And hey, everybody, it's Dr. Yuli Harrison Lloyd. I am a family medicine doctor who's currently working in an ER setting. Glad to be here, and I am so excited to see where this talk goes.
Yes, I am too. Now, if you're with us, don't forget to like, share, and subscribe. We are on YouTube, Facebook, Instagram, and we would love to have you join our crew. We also have a segment on Facebook called Conversations with When Docs Talk, and that allows people to actually post either with your name or anonymously. And I want to let you all know about that because tonight, if you have any questions that you feel like you don't want to ask us in the open, go ahead and post it anonymously in Conversations with When Docs Talk on Facebook. You can also message us on Facebook at When Docs Talk, do a direct message, and only we will know your question. We will not put your name out there. We will not put your face out there, but we will know what you want to know and we'll get it answered. All right. So let's jump into what we came to talk about. We came to talk about the ABCs of OOO. We want to know what you know about the big O and what you'd like to know about the big O. And in that, we are here to answer any questions you have, but we're also going to be joined by people that this is their specialty. They have so much wonderful knowledge to impart to you. before I bring them on, I just want to put up some stats and facts about orgasm, because that's what we're talking about here. We're talking about the big O. So let's go. So what is an orgasm? I put this out there. It seems intuitive to some people, but you'd be surprised. Even in the poll that we sent out, which thank you all for filling it out, those who did, there were some people who weren't really sure if they knew what an orgasm was. When we refer to orgasm, also known as coming or climaxing, and there was a bunch of other kind of slang euphemisms for orgasm, but it's basically when a person reaches the peak of their pleasure sexually. It happens when you're at the height of your sexual arousal and your body releases tension, and the muscles in your genital area, the perineal muscles, the anal sphincter, reproductive organs, all rhythmically contract. Now, for men, what's going on during orgasm is the muscles in the penis and the anus may contract, for about 5, 8 times. Of course, everyone's different. The heart and the breathing rates increase. Typically with men, and this is not all the time, but typically most men, when they climax, when they have an orgasm, they release semen. And immediately after orgasm, the head of the penis may feel more sensitive and uncomfortable to touch. Now let's contrast that with us ladies. So with the ladies, what happens? When women orgasm, once again, you have those muscles in the genital region that are contracting. So the muscles in the vagina and the anus may contract, and they do so around the same number of times as men. Of course, everyone's different. Everybody's different. Heart rate, breathing, just like the guys, goes up. Before and during an orgasm, the vagina may become wet and can even sometimes ejaculate some of this fluid. In fact, estimates say that about 10 to 70% of women do ejaculate or do release fluid during orgasm. And immediately after, just like the men, our sensitive spot, the clitoris, may feel more sensitive or uncomfortable to touch. So some people asked me about orgasms, like, how do I know if I've orgasmed? How long do they last? Just some quick stats and facts. According to a 2016 study, female orgasms may last around 20 to 35 seconds. There are lots of different types of orgasm, right? So a lot of times we hear about the clitoral orgasms, and that's because 60% of female orgasms occur during, stimulation of the clitoris. But there's also vaginal orgasms. There's blended orgasms where you can have both a clitoral and vaginal orgasm happening together. There's anal orgasms, which happen when there's just penetration or stimulation of the anal region. And there's G-spot orgasms, which happen with stimulation of the G-spot. And believe me, ladies, we're going to talk a little bit more about that later. But I want you all to know that in terms of orgasms, 80-something percent, 81.6% of women don't orgasm from intercourse alone. Whereas men, most of the time when they have sexual intercourse, 95%, they usually orgasm. 65% of heterosexual women they were looking at in this study reported that they do orgasm. So men typically orgasm during sex more than we do, is all that says to me. Mm-hmm. Up to 10% of women say they've never orgasmed, and 59% of them have faked an orgasm. That's all I got to say about that. And women in relationships who are in long-term relationships, they did a study, they tend to have more orgasms as opposed to those who have a first-time hookup. So there's a lot about orgasms that are great. We asked our viewers, actually, we asked in the study if they feel that orgasms are overrated. And the funny thing is, I'm going to show you here. Let's see here. Do we have it backstage? Okay, that's okay. So actually, most people said absolutely not. False. They're not overrated. They're very necessary. It's important. Why is it important? So when they do studies on orgasms, first thing you should know is that there are certain neurochemicals that are released. So you have endorphins, you have things like oxytocin. I'm going to actually ask, can we pull off that? Okay, great. And some of these hormones that are released during orgasm help with different healthy sexual and not necessarily sexual, just general health function. So they've done studies to show that you get better sleep. There's increased intimacy and closeness with your partner, overall stress reduction. They've also done studies that demonstrate that when women orgasm, they tend to have lower blood pressure if they're orgasming regularly. Their immune system tends to be stronger, better heart health. There's some studies that showed less cardiovascular disease with regular orgasms and improved self-esteem. There's also increase in, I'm going to take this down here. So there's also an increase in strength of the pelvic muscles. We're going to have a pelvic therapist talk about that, because the same muscles that contract during orgasm are the same muscles that we use during Kegel exercises. I'm sure some of us know about Kegels. And so when you're orgasming, you're actually strengthening those pelvic floor muscles. So orgasms, not overrated. You all told us that. Orgasms, we know what they do. We know what they're doing to our body now. We're all on the same page. So let's get our experts in here so we can talk a little bit more about not only orgasms, but our bodies, the different barriers to a healthy sexual life, and all the questions that you all have to ask. All right. And we will bring them on right after this brief break. We'll see you soon. Don't go anywhere. All right. So we are back from our brief break. That was SkinWorks Day Spa here in Covington, Georgia. I want to just, without further ado, bring on our guest. I want to tell you a little bit about our first guest. But before I do so, remember, if you have any questions, feel free to post them throughout. Also, if you want to ask a personal question that you don't want everybody to know your name, go ahead and send it to our DM on When Docs Talk on Facebook, or you can also post it anonymously in our conversations with When Docs Talk. But let's bring out our first guest. First guest is an amazing woman. Let me tell you, I know her personally, and I'm so excited to have her with us. Dr. Julianne Burke is a leading voice for women's health. In her 17th year of practice, she is the founder and CEO of Radiant Women's Health in Metro Atlanta. She landed south from Harrisburg, Pennsylvania in 1991 to matriculate at Clark Atlanta University, and after which she taught high school science and health in the Atlanta public schools, and then obtained her medical degree from Morehouse School of Medicine. She served as the solo chief resident and was the first Black female physician to graduate from Allegheny General Hospital OBGYN residency program in Pittsburgh, Pennsylvania in 2005. She is a personable physician who's grown her practice exponentially, serving women from Atlanta and all its environs. She has a reputation of being an educator in the exam room, and her fervor for women's health, and notably female sexual health and dysfunction, has brought her before the FDA and US congressmen advocating for sexual health equity for women. She's also served as an advisor and speaker for several pharmaceutical companies and has the pleasure of presenting at national and international meetings. With an ongoing presence in local schools, churches, and community forums, she formed Dr. Ju Delivers. Her platform she uses is Pushing Wellness for Women. A love for community drives her volunteerism, and she has served as a medical director of a pregnancy center and is an assistant professor of community medicine for Mercer University School of Medicine. She's also fluent in American Sign Language and serves as a church interpreter for the deaf. She is a lifelong member of Alpha Kappa Alpha Sorority Incorporated and has received numerous awards for her business and community work. Being honored by her peers has meant the most, as she was recognized as the 2015 AMA Young Physician of the Year, and in 2019 was bestowed the GSMA Distinguished Service Medallion. Despite the challenges and joys of juggling a busy practice among her community and the leadership endeavors, the role that she most passionately reveres is that of mother and wife. Please help me welcome Dr. Julianne Adams Burke.
Oh my gosh.
Hello, hello.
Hello.
I was like, oh, she sounds amazing. Wow.
That's you. That's you.
Yes, and we are so honored. I mean,
Oh, yeah.
we got some badasses on your show tonight.
True.
So we appreciate it. And one of the things
Absolutely.
that stood out for me was a comment that was in your bio that says you were pushing wellness for women. And I love that.
Absolutely.
You know, and so what does that entail when you say that, pushing wellness for women?
So I'm going to tell you, you heard earlier that I served as a science and health teacher at first. And my mother was an educator for 35 years before she retired. My father was a band director, and then he was a principal. I absolutely love being a teacher. And so my mom was like, you're not going to fall in love with, you know, being an educator and never go to medical school. I was like, no. And one of my attendings said to me during medical school rotations here at Grady Memorial Hospital, he said, you know, think of it this way. When you become a physician, you now have an opportunity to continue to teach, but now your classroom size is 1.
Yeah.
And so in my exam rooms, or when I go out to schools and churches and communities, I feel like this is an opportunity for me to marry both worlds. And we all know, for all of us who are in healthcare, you've got to push some people. You've got to get in their faces sometimes. You've got to say, you know, ma'am, you told me you wanted to go to your son's graduation. You need to take your blood pressure medication. So I do that in a way that I think is impactful. I do it every day in my office, but I also love doing it when I'm out speaking and even in a forum like this. So I'm excited to be here. Thank you.
Yes, and we're excited to have you. Thanks so much. We're going to bring our next guest on.
Okay, I have the absolute pleasure of introducing Dr. Angelica Whaley. Dr. Whaley grew up primarily in California and Georgia as the baby amongst her 3 active and inspiring sisters, a father who retired early from being an electronuclear engineer, and a mother who spent her life serving as an RN. She obtained a BS in kinesiology and health promotions from the University of Kentucky and a minor in Spanish. She committed to running track and field on scholarship. While at Kentucky, she went on a life-altering community service trip to Ethiopia through her athletic department that sparked her interest in public health and health disparities. She went on to receive her doctorate of physical therapy at Northwestern University. While there, she became one of the founding members of the inaugural Global Health Committee and Black Student Committee, and also developed a passion for pelvic health PT. The more she learned about it in school, and has been doing it ever since graduation. She has since become a pelvic health physical therapist, and she says that she realizes that she enjoys treating pelvic pain the most. She loves neurological PT, and we know that with chronic pelvic pain conditions, there can be an alteration in the way that the body processes pain. She helps patients manage the biological, psychological, social, emotional, spiritual, and of course, the physical contributions and manifestations to their symptoms so that they can partner along the journey to the other side of pain. Her future plans and interests include eventually returning to school to get a master's in public health, to develop ways to advocate for change for the commodification of and heal women of color who experience sexual violence and birthing trauma at disproportionately higher rates than their counterparts on a more of a macro level. And I have to say personally, Dr. Whaley is amazing, and I am so happy to welcome her to this show here tonight.
Welcome, Dr. Whaley.
Hello, everyone. Thank y'all so much for having me. I'm so excited. So yes, I am a pelvic health PT. I like to say an orthopedic PT specializing in pelvic health at the Pelvis Pro here in Atlanta in the Midtown area. I treat women across the lifespan. So whether they're nulliparous and never had children, they're in the peripartum phase, so they're prenatal or they're postpartum, women who have menopause, and everything else across the lifespan. Everything in between. So if you have pelvic floor dysfunction, it can lead to bladder, bowel, sexual dysfunction. I'm treating all of that in my daily life. And so my passion is pelvic pain.
Awesome. We love
Dr. Whaley, it's so amazing to meet you. It's such a pleasure. I'm so excited. But I do have one question for you. What exactly is pelvic PT? Can you explain that to us?
The $1 million question. So pelvic floor PT, it's pretty much considering the muscles of the pelvic floor. We have this bowl pretty much at the bottom of our body. We're considering the musculoskeletal system. So think like bones to an extent, muscles, tendons, ligaments, fascia are connective tissue that intertwines our entire body. And then your neuromuscular system, so nerves and how those communicate with those muscles and how they affect your bladder function, your bowel function, your reproductive function, and consider that within the entire body and how it functions and how it moves. And we work on improving women's quality of life within that, specifically within our clinic. But I do want you all to know that everybody has a pelvic floor. Men do too.
Awesome. Thank you for that. Thank you.
Thank you. Welcome. Let's bring on our last expert. I have the pleasure of telling you about Dr. Jasmine Kearse. Dr. Kearse has been a physician practicing psychiatry in Metro Atlanta for several years. She completed her residency at one of the most extensive psychiatric facilities in New Jersey, returning to Atlanta to provide her expertise to a community that helped grow and nurture her as a physician. For many years, before deciding to explore the world of private practice, Dr. Kearse worked as a high acuity inpatient psychiatrist in a local Atlantic psychiatric facility. This unique exposure allows Dr. Kearse to understand the management of mental health patients at their worst. Her goal is to provide you with psychiatric treatment specifically catered to you as an individual, assisting in rejuvenating your outlook, preserving your stability, and hopefully preventing severe decompensation. Dr. Kearse's motto is, "The only difference between those perceived to be functional and you are coping skills. You can do this." And with her help, the beginning path to your fully functional self is an appointment away. Although Dr. Kearse continues to work with the highly acute population, she is interested in women's and perinatal health. She provides in-depth knowledge of biological and psychological factors causing disturbances in the mentation of females. This includes women who have suffered pregnancy loss, fetal demise, abortions, loss of children, inability to become pregnant, and those with no desire to mother children, as well as those with failed attempts. She can also provide treatment options for sexual dysfunction. Perinatal psychiatry combines skills designated for women at their most vulnerable and stressful times, and we are so excited to have her as part of our discussion today. Please welcome Dr. Jasmine Kearse.
Hello. How's everybody doing?
Well, thank you for joining us tonight.
Thank you for having me. Thank you.
We feel honored. Okay, Dr. Kearse, I have a question. How much of sexual health in women, specifically women, do you think is controlled by the mind?
100%.
Okay.
100%. If you cannot stimulate your mind first, how would you stimulate your vagina? Your mind, everything's connected. So someone needs to be able to connect with your mind. And then as that connection is made, everything else will follow. But, so many times men are so focused on trying to get to what the big O is, what we're here to talk about, that they forget the fact that we are very much intelligent people and we need to have our minds and neurons and everything else that goes on in our brains, the neurotransmitters and everything else that kind of connects the brain. You need to have that part before you can ever try to step in and have sex.
Right.
So,
Touché.
Thank you.
I hear that.
Okay, everyone. Thanks so much for joining us. That completes part 1 of ABCs of OOO. Don't miss our next episode. We're going to break down the female anatomy, talk about how to make your orgasms better and more intense, and basically answer all the questions that you all want to know. Thanks so much for joining us. We'll see you on part 2. Have a great Valentine's Day.
When ducks talk, when ducks talk, when ducks talk, when ducks talk. when ducks talk, when ducks talk.